I get a lot of people to ask me questions, and I thought I'd go over a couple questions with you because they're very common questions. The first question I had this week that kind of threw me was a patient asked me, how do I get my 37-year-old daughter to stop smoking? And I told her the answer is you don't. There's no amount of nagging or explanation or fact finding that will get an adult to, the 37-year-old is essentially an adult. There's no way to get people to stop smoking. I don't think it's possible. You can't explain to them that smoking is bad. It's not like they're going to go, oh my goodness, I didn't know that. I'm going to stop right now. That doesn't happen. Telling them that it's bad for them, it just doesn't work. They know. Nagging doesn't work. If you're a parent and you're concerned about your child smoking, I don't think there's a whole lot that can be done. The reality is what makes people stop smoking is usually a health problem, like a heart attack or a stroke. And it's a wake-up call. It's almost like any drug. You have to hit rock bottom before you stop, or something has to happen. Sometimes people will become pregnant, if it's a woman, or if it's a male, their wife will get pregnant and they don't want to smoke in front of their kids. Various reasons, but the person has to decide themselves. Another question someone asked me was they had a pinched nerve in their neck and they said, what can I do myself to instantly get rid of the pain? I just want the pain to go away instantly. What can I do myself? I wish I knew. If I could make pain from a pinched nerve instantly go away and teach you how to do it yourself, that would be awesome. Of course, when you go on Google or YouTube or anything, you could type in how to fix things yourself. And there's lots of people showing various stretches and with the promise of instantly relieving pain from a pinched nerve, but it's just unlikely to happen. It's not realistic. So the thing is that most people, when they're asking this question, they just want instant pain relief. And the reality is, if you want instant pain relief, the only way to get that is to go to a hospital. They inject a pretty hardcore narcotic or opioid type of drug into your system, and you just absolutely will not feel pain at that moment. Of course, it wears off. As a chiropractor, I'm more concerned with how do we take care of that pinched nerve and the cause of that pinched nerve for the long term. So that's why in chiropractic, we may not get instant results, but we often get results that last a long time and are better for your health. Another question that I almost answer daily for patients is, what did I do to myself? What caused this? Or another question is, I didn't do anything. Why is this happening to me? There are two types of injuries. One that is obvious, and this is what most people think of as an injury that causes pain. So a person gets in a car accident, they fall down a flight of stairs, they fall on their knee and their knee hurts. That's an easy explanation. So if a person falls down a flight of stairs and hurts their arm, they totally understand why their arm hurts because of the fall. But if you wake up in the morning and your neck hurts, you don't usually associate that with an injury. So patients will often ask, what did I do to myself? What happened to me? And the answer is there's another type of injury, and it's not an injury that is a sudden injury. It's a chronic injury that develops over a period of time. And so I liken this and give an analogy to smoking. If a person were to smoke a cigarette and smoke 20 cigarettes a day, that is technically an injury to your lungs and your health, but the results of it don't happen right away. As your health gets worse and worse and worse, it'll often pass a threshold where you will actually have either emphysema, or you will have a heart attack, or you will have a stroke. That's the threshold. So the same thing is with the spine. If you have spinal disorders or spinal misalignments built up over time, what happens is eventually it hits a threshold. That threshold may be while you were sleeping or while you were moving, doing something, and then all of a sudden it passes that threshold and suddenly it becomes pain. So patients will say, I didn't do anything. And the answer is, of course you did. People just don't wake up with neck pain for no apparent reason. you've probably had a neck disorder developing over a period of time, and finally one day it passed that threshold and now it's noticeable and becoming painful. So that's what's called a chronic injury. Very often people will describe it as a repetitive stress injury. So these things are a little bit confusing to patients because they don't understand what caused their pain, but it's usually a repetitive strain on an area. So those are some of the questions that I've had asked of me this week. If you have any questions and concerns, there is no wrong question, but sometimes we don't have the right answer for you. But the thing is that we have a truthful answer. So if you have questions, you can ask them in my YouTube channel, and I'd be happy to answer them for you.